Good afternoon and welcome to this community briefing. Joining us once again to provide interpretation is Margie Prop. Thank you so much for your dedication, Margie, for being here today. And thank you to all of you for tuning in to learn more about the latest local developments in our collective effort to help end this pandemic. Spring is here and we are seeing our community blossom once again with many familiar outdoor events returning and some new ones emerging. Saturday's spring game was one of the biggest events in the state in a year. Sunday's marathon was one of, if not the, largest road race in the country so far this year. And our local farmers markets reopened this past weekend to the delight of everyone who likes to buy fresh greens or homemade cinnamon rolls. And just yesterday, we announced an exciting free performance by the American Ballet Theater when they kick off their national tour July 1st right here in our beautiful Pioneers Park. Now, these joyful events are on our calendars here in Lincoln in part because of the incredible efforts we have made as a community to stop the spread and to support each other's health and safety. The work we've done together to get vaccinated and the common sense precautions we've taken together, wearing masks, washing our hands, and watching our distance from one another, they are paying dividends and moving us forward to a brighter future. So let's keep moving forward together. To do that, we need to continue to make solid progress in our vaccination efforts, even as the pace of that progress predictably shifts as our local situation evolves. We know and celebrate that with nearly half of our population fully vaccinated, the most vulnerable members of our community, and many of those who were eager early on to roll up their sleeves, are now protected, and that's a huge victory. We also know that we still face challenges. Our work to safeguard the community and to slow the spread is not finished. And that's why, for those who have not yet received a vaccination, our health department will continue its diligent efforts to provide all eligible residents with additional opportunities to get vaccinated as easily and conveniently as possible. And to ensure that that access to a vaccine is not only easy and convenient, but also equitable, our health team works with a variety of partners to bring vaccination clinics to the community. In recent weeks, they've partnered with area high schools, colleges, universities to host on-site clinics for students and parents and guardians, and those have resulted in more than 2,600 people getting vaccinated. The health team is also expanding neighborhood-based clinics and working with partners to hold those clinics at recreation centers, churches, and other locations that are familiar and close to home. However, the health department's efforts to stand up these clinics is only half the story, and the end of this chapter depends upon the rest of us. It depends upon all of us stepping forward to get vaccinated so that we can protect our families, friends, and neighbors. You can register and schedule your vaccination appointment at covid19.lincoln.ne.gov. Just click on the Vaccine Information tab, or you can call the Health Department at 402-441-8006. And with all that we have been through together over the past pandemic year, I have so much faith in the people of this community and what we can accomplish together. Thank you in advance for your care and commitment as together we work to beat this virus. And now I'd like to invite our caring and committed Health Director, Pat Lopez, to come forward and to update us on local conditions.
Thank you, Mayor. As the Mayor said, our collective efforts really are moving our community ahead, and we thank everyone for continuing to do their part to protect themselves and each other and help end this pandemic. We have widely shared our 75% goal for those age 16 and older to get vaccinated. And here are some numbers to help put this goal in perspective. The population in Lancaster County of people aged 16 and up is approximately 246,000 people. So to reach our goal of 75%, we need about 184,000 residents aged 16 and older to be vaccinated. We are getting closer to our goal each week. We now have more than 163,000 residents who have already initiated vaccination. That's 66% of the population aged 16 and older. And as of today, almost 120,000 residents are fully vaccinated. That's almost 9% of our population age 16 and older. So to reach our goal, we need about 20,000 more residents to get vaccinated and help our whole community to be better protected. On this chart, you can see the percent of residents who have received at least one dose of vaccine by age group. You can see that we have 3 age groups marked in green, that they have reached the 75% mark for initiating vaccination. We're pleased with the progress in vaccinating these vulnerable residents. We recognize that over the course of the vaccination effort, these age groups have had a longer period of time and more opportunities to get vaccinated. The age groups between 16 and 44, currently in red and orange, are more recently eligible for vaccine and haven't had as many opportunities to get vaccinated. COVID-19 vaccine provides protection to people in every age group, including younger and healthier adults. Due to the progress with vaccinations, we've been seeing a steady decline in cases for those over 65, but we are seeing a higher percentage of weekly cases in our younger age groups. We know the virus can still cause serious illness and hospitalizations in our younger residents. The percent of weekly cases in young people aged 10 through 18 has increased from 10% at the beginning of February to about 16% at the end of last week. Most of the recent cases in that age group are 17 and 18-year-olds. The percent of weekly cases in residents aged 19 to 24 has also increased from 12% at the beginning of February to about 17% at the end of last week. We are seeing the same trend in local hospitalization. Since the beginning of the pandemic, 26% of the hospitalizations in our county have been those under the age of 45. But over the past 3 weeks, 42% of the local hospitalizations have been residents under the age of 45. The chart you're now looking at shows the percentage of COVID patients by age groups. The blue bars are the overall percentages since the beginning of the pandemic, and the yellow bars are the percentage over the past 3 weeks. You can clearly see that the yellow bars representing the past 3 weeks are all higher in the age groups under age 55, and the yellow bars are all lower in the age groups over 55. The variants of the virus are another factor to consider. We don't know the full impact these variants will have locally, but so far we are seeing variants identified in younger age groups as well. A total of 57 variant cases have been identified in Lancaster County. Only 11 of these cases have been with those age 50 and older, and 31 of the cases, or 54%, have been in those under the age of 30. Joining us today via Zoom is Dr. Kevin Richmond, a pulmonologist with Nebraska Pulmonology Specialties. He's been providing critical care on the front line since the beginning of the pandemic, and we asked him to share what he's seeing now with cases in younger adults. Dr. Richmond?
Thank you, Pat. Can you guys hear me okay?
Yes.
Okay. Yeah, thank you. I was on this, the mayor's press conference back in November, shortly before Thanksgiving. And in some ways that seems like yesterday. In other ways, it seems like an eternity, and talk about a different situation. I mean, that was, we were up to our ears in critically ill COVID patients, and frankly, at times feeling helpless and hopeless. And here now we are, not too far after that, with much more hope, largely brought by the vaccinations. And I think your graphics fit exactly what we're seeing, in that all of the eligible people early on who stepped up, got their vaccinations. We're seeing those not impacting us as much, and not being admitted to the hospitals and so forth. But we have definitely seen an increase, and this is nationwide. I pulled up the data. 35% of all hospitalizations right now in the US are under the age of 50, and if you go 50 to 64, it comes to 64 or 66%. So really, that group that was at high risk of hospitalization and death have been vaccinated, and we're seeing the fruits of that. And so Now what we're seeing, and I think this is what I love about Nebraska is, we step up and do things for other people. And that right there is a reason to get vaccinated, because you're going to protect your family, your community. But I would make the argument, you're going to be protecting yourself. What we're seeing is in a number of these young individuals, it's not just a benign cold. It is clear that COVID causes more serious illness, certainly more likely than other viral disease, including influenza. Several studies now showing that. And I'll give it a couple examples. I had a college student, this is several months ago now, who contracted COVID in the last May, very active runner, and contracted it. And so this was, when I saw her, it was about 5 months after her original illness, and still not able to be back to the running she was doing. And there's really nothing you can do. The only thing we can do is reassure her, tell her to keep working at it. And so it does have an impact on young, healthy people. We're certainly seeing young people that get ill enough to be compromised more substantially than that. Recent study showed that up to about 15% of patients, even up to 8 months, will have some, and some of the data was even more striking in the younger population, will have persistent symptoms that can limit them at home and at work. These things ranging from fatigue, cough, shortness of breath, muscle aches, the common brain fog that you hear about. And so it is not a benign disease. And as I've said many times, it's Russian roulette. And now we have a way to prevent this almost 100%. I mean, nothing's 100%, but the vaccinations have been shown to be very safe and effective. And even if you do get it, much less likely evidence is showing to develop any of these kind of symptoms, including this, what we call long COVID or post-acute COVID sequela. And so I would urge people in this population that has deemed themselves not to be at risk, to get the vaccination. Do like we have always done. Get it for yourself, get it for your family, get it for your community. Please. We only have to look to Michigan to see what can happen with these variants. And in the younger population, they had another surge that unfortunately hit before they could move as quickly with the vaccinations. I don't want that to happen in Nebraska. I don't want that surge to impact our system or shut down these things that we're seeing opening up. We all want this to end, and want to see things like the Husker baseball game and the spring game that we saw. For everybody that knows me, they know I like kind of sports analogies. And what I would say is, we've gotten inside the red zone, and we did that doing certain things, all the things the mayor just outlined, and these vaccinations. And so what drives us nuts more is when our team inside the red zone starts doing different things, not sticking with the script to finish the drive and get in the end zone. So let's go through, let's score a touchdown in this red zone by getting our vaccinations and continuing to do those things until we have an adequate portion of the population vaccinated. Thank you.
Thank you, Dr. Richmond. If you fall into one of these age groups and haven't received your vaccine, we urge you to get vaccinated as soon as possible. We expect to continue to make steady progress in our vaccination efforts, but in smaller increments than we've seen previously. We are committed to ensuring every Lancaster County resident has the opportunity to receive vaccine. As we mentioned last week, we're expanding smaller scale community clinics in the community. These clinics will provide residents with additional options that help make vaccination more accessible, convenient, and closer to home. Clinics are scheduled every day this week, and some of the clinics will allow walk-ins. Yesterday, we had a second dose clinic at the Center for People in Need in partnership with El Centro. Today, we have been providing first doses at the Air Park Recreation Center since 3 o'clock. That clinic goes until 7 this evening. Tomorrow, we will be providing first doses at the Belmont Recreation Center from 4 to 6. The other clinics this week are 2 drive-through clinics providing first doses at Gateway Mall on Wednesday and Saturday. We'll also be providing first and second doses at the Lancaster County Event Center Thursday and Friday. And next Wednesday, May 12th, we are hosting another neighborhood clinic in partnership with the Black Clergy of Lincoln at City Impact. And joining us today to talk more about the upcoming clinic is Lincoln pastor Janet Goodman Banks, who is also president of the Lincoln Women's March, and Pastor Marcus Larry Vo from Allen Chapel. Thank you both for being here.
Good afternoon. It is an honor and a privilege to stand before you this afternoon to share our hearts and declare that the Black clergy of Lincoln is invested in our community. We are so much so that we have turned our immediate attention collaboratively with the Lincoln Lancaster County Health Department to sponsor a vaccination clinic at City Impact. This wonderful nonprofit organization is located at 1035 North 33rd Street in Lincoln, Nebraska. So if you live in Lancaster County, we would like to encourage you to come and see us and get vaccinated. The date of the first clinic, the first injection, will be on May 12th from 3 p.m. until 7 p.m. The second vaccination clinic will be on June 2nd at the same times mentioned, from 3 p.m. to 7 p.m. We would like for you to go to the Lincoln Lancaster County Health Department's website to register. Also, we need volunteers. There will be 2 shifts that will run in intervals regarding volunteers. The first shift will serve from 2:30 p.m. until 5 p.m. and the second shift from 4:30 p.m. to 7 p.m. If you would like to volunteer, please contact me at janetgoodmanbanks@gmail.com. We are so excited and ready to serve you, your families, and your friends and loved ones. Pastor Marcus Larvo will now come to inform and inspire you regarding the next vaccination clinic. Thank you.
Thank you so much, Pastor Goodman Banks. Our next vaccination clinic will be on June the 2nd, and we are encouraging you to come out and receive the second dose. All of those who are coming to our first vaccination clinic on next week will be available on June the 2nd to receive their second dose. I want to make a special appeal today as part of the Black Clergy of Lincoln to our young people of Lincoln. I'm encouraging you to come out and get vaccinated on next week. The reason why I'm calling to our young people specifically is because I understand as a young person in Lincoln that some of our young people have had doubts about whether or not to get vaccinated. But I've gone to get vaccinated, and the reason I've gone is because I've been encouraged. I've been encouraged by our community that has had the courage to follow the science. But I've also been encouraged by our community that has had the courage to care for one another. The truth is that we are stronger as a community when we care for each other. And your getting vaccinated is not just about you, but it's about your neighbors, your friends, your family who may have pre-existing health conditions. Your getting vaccinated is not just about you, but it is about those who may have health conditions that they don't know about, or those who may not have an opportunity to get vaccinated yet. By going and getting vaccinated, you're able to take care of your own health, but you're also able to show love for your fellow men and women in this community. So I encourage you, come out, get vaccinated, and let's be safer and stronger together. Thank you so much.
I really can't express enough how much the health department has appreciated our work with the with the pastors. It's been really remarkable to see the response in the community, and so I'm very grateful for everything that they're dedicating to our community in concern to get people out and get vaccinated. I also wanted to let you know we are going to have another neighborhood clinic at the F Street Recreation Center on May 18th from 3 to 7. And as Pastor Janet mentioned, you can sign up and schedule an appointment at the upcoming clinics at covid19.lincoln.ne.gov. You can also find a local pharmacy offering vaccinations at vaccinefinder.org. We have some new information regarding the Pfizer vaccinations for those under age 16. The Food and Drug Administration could expand its emergency authorization for vaccine to children 12 through 15 years old in the very near future. We are preparing for that possibility, and if Pfizer vaccine becomes available for that age group, we will have more information. Taking a look at our other COVID information, the COVID-19 risk dial, our local data continues to hold steady and make small incremental improvements. So this week we remain in the yellow, low yellow, for the third week. The number of new weekly cases dropped from 300 the week ending April 24th down to 247 cases this past week ending May 1st. The positivity rate has stayed consistent over the past few weeks and has showed a decrease from 7% the week ending April 24th to about 6.1% the week ending May 1st, last Saturday. The number of local patients hospitalized with COVID-19 averages 30 for the month of April. Today, we have 29 patients hospitalized locally, with 21 from Lancaster County. We have had no COVID-19 deaths reported locally since April 19th. This chart shows how the metrics are combined to show the position of the risk dial. The average turnaround time, the contact tracing capacity, and the number of deaths are all in the green. The rate of new cases and the healthcare capacity are both in yellow. The positivity rate and vaccination percentage are both still in the orange. To get to the green on the dial, we need to continue to see the number of vaccinations increase and see a continued drop in our weekly cases and positivity rate. The yellow position on the dial indicates a moderate risk of COVID-19 spread and impact in the community. With people becoming more active, we encourage everyone to maintain caution and wear masks in indoor public areas and crowded outdoor spaces. With that, we'd be happy to take any questions.
Hi, this is Bailey Bischoff with 1011. I had a question about vaccine waste. At any of these clinics that are smaller, if you have fewer people than expected show up, have you had to throw away any vaccines at this point?
You know, Bailey, we really monitor very closely, and at the smaller clinics, even at the larger clinics, and some people that come towards the end of the clinic can certainly tell you that because we actually count people for a period of time. We haven't had a problem at any of the smaller clinics at this point yet. But we are aware that that could happen when we have, individuals walking in and not being able to account for that. But we do start to really watch closely when we're getting towards the end of the clinic time. And we always try to have an alternate plan in place too.
With Channel 8, looks like Lancaster County is doing pretty good, but are you worried at all about hitting that 75% goal? And if we do hit it with variants and, the potential need for, booster shots, I guess you'd call them, down the line, do you anticipate that you'd be able to maintain that level of vaccination going forward?
We're still working towards that goal of 75%. We're going to continue. And you probably heard when we said we're at 66% for our first doses. And President Biden wants the country to be at 70% for first doses by July 4th. So I'd say we're doing pretty good here right now. But we'll just have to wait and see what happens, Brent, with the variants and how that moves forward. I expect our community to continue to respond the same way we have, and we'll be able to continue to provide vaccines as needed and keep working forward.
How much would it help for younger kids, whether it's 12 to 15 or even younger than that, in reaching that goal if the vaccines were opened up to the younger age groups? How much would that help?
You know, we really are, when you look at our age groups on the chart, we really need to get to a higher percentage of our 16 to 24-year-olds and 25 to 34 years old. Anyone under the age of 44, we want to get those numbers up. We're almost at 57% in those 33 to 44. The 12 to 15-year-olds, should that become available, we're going to do that and provide that vaccine. But when we set this goal, we were looking at our population 16 and older, and that's what we've committed and shared with the community, and we're going to continue to work to that range.
Outside of just not having as many opportunities so far to get vaccinated, are there any reasons that you've found, I guess, like common themes as to why that particular age group is not getting vaccinated nearly as much?
I know you might find this hard to believe, and some others might, but some individuals that we've been talking to and getting information from are actually saying, well, they just hadn't gotten around to it. And they really hadn't just scheduled an appointment. I know that sounds kind of like when all the rest of us in different areas, especially coming from me, thinking that, you know, getting vaccinated is one of the biggest things we have going in the community. So that's where we're hearing a lot of. So we're doing a lot of, we put in a lot of efforts to reach out to the population. And also, I think working with our community members like Pastor Janet and Pastor Larry and really telling our younger people, hey, we need you to help us along here. And it is really important. I am concerned, aside from all that, when we see more cases in this age group and we have more variants, and we're seeing more cases because people are more symptomatic and they're going in and getting tested. So just out of concern for those young people, I really want them to get in and get vaccinated.
This is Bailey with 1011 again. What do you think would be a reasonable timeline for hitting that 75%? I mean, just looking at the numbers of how many people are initiating vaccinations for the week of April 9th, it was up to 23,000 people initiated vaccinations for that week. But for last week, only 3,200 people initiated vaccinations. Do you anticipate it's going to be slower moving forward?
I think it will be slower moving forward, but I want to remind you we did an 8,000 dose clinic last Friday, and those numbers are coming in. Those were second doses to get people fully vaccinated, and we'll be at Lancaster Event Center on Thursday and Friday, and we have a little over 8,000 people that will be getting second doses too, in addition to any others that want a first dose. So definitely, Bailey, it's going to be, it's going to be a slower process because we'll have smaller numbers when we go out into the community. But we're seeing good registration at those neighborhood sites. And I think that's really important to make it accessible for individuals in their own neighborhoods and places where they feel really comfortable.
What is that reward at the end of that 75% that people should really be looking forward to? What's that thing to push them to make that appointment?
Well, I think it's a big difference on where we are as a community and ensuring that we can continue to move forward and not move backwards. I think that's the biggest reward, that our life returns to doing many of the things that we really enjoy on an ongoing basis.
This is Brent. Just a quick clarification. You mentioned if Pfizer does get the emergency use authorization, would the health department open up vaccinations to kids 12 to 15 immediately or in the same week?
Actually, Brent, that's a really good question, and I wasn't saying that, but if we receive that on the beginning of the week if we're told that that's approved. We've already selected dates at the end of the week, so yes, we will open immediately, and we'll have it up on the website so parents can go in and schedule their appointment right away for their child.
I just have one last question about the mask mandate. Omaha has said theirs is set to expire at the end of May. I know our current DHMs expire May 21st. So you may not have an update now, but any idea on what it would take to end the mask mandate, or if that's something that's on your radar at this point?
Mask mandate is always on our radar, and we are watching where we're at, and we're looking at where our cases are and our community spread and our vaccination numbers, all of those things, and we're continuously evaluating that. And as we move forward as a community, we expect there to be changes that are commensurate with that. Thank you.
Hi, Pat.
Hi, Matt.
Hi, how are you? Just a couple of quick questions for you.
Sure.
One, have you guys considered, I know you've sort of moved toward these smaller clinics, going to where people are, so that's kind of a change from a few weeks ago. Have you thought about doing things like walk-in clinics or getting physicians' offices involved, maybe with vaccines that don't require the storage that the Pfizer one do, to try to hit more people, or going to events and just sort of offering people a vaccine while they're doing something else to try to hit more people?
Yeah, looked at several different events, and we'll be working with our Black pastors about some other future events after the city impact. And we're also looking at other places. As far as the physicians' offices right now, all the physicians' offices are involved with us in getting people in. And some of the vaccine, there's still requirements, even if you don't have the ultra cold for Pfizer. There are some requirements once you puncture a bottle or you move it and put it in the refrigerator. So we're continuously working on that, Matt. And I have ongoing communication with our physicians, and when we'll be ready to be able to move that forward so they can do it. You know, we're a bit disappointed. We learned last week that Moderna, instead of going down to the single doses we asked them, is actually increasing the number of doses in a vial, which makes it really challenging for a physician's office to be able to manage that. And that can create a real burden in just, you know, trying to schedule patients and get them in and get the vaccine delivered. But absolutely, we're going to always continue to work towards that, so that'll be offered in the physician's offices.
Okay. And then in terms of people getting second doses, is that continuing to be a really high percentage of people that are coming back and getting their second dose?
Yeah, it continues to be a really high number of people coming back, and we're always watching and we're following up to make sure that people have gotten their second doses. There could, I think I mentioned before, there could be other reasons why they haven't been able to get it. Maybe they were ill or something else happened, but we're continuing to work on that.
And then one last question for you. I continue to hear from people about what seem to be, they got their vaccine at Hy-Vee or somewhere like that, and they continue to get emails from the health department about getting a vaccine. And so they question whether, it's been recorded that they've been vaccinated. Is that, if somebody is getting their vaccine from the federal retail pharmacy program, are they showing up eventually in the state system or in the health department system as having been vaccinated, or are there issues getting those people accounted for?
There were some issues early on, and we've had a couple issues here in the last week or so, but we're monitoring that closely and working with the state on that and the retail pharmacies here. I will call them if we start noticing that people aren't getting in, and that's resulted in some people being notified to come in for a second dose when we didn't know they went elsewhere for their second dose. So that I know that can be a little annoying at times, but if people can just bear with us, and I'd rather be assured that they've been notified to get their second dose. So we're working through that.
And then one last quick question. So when you guys do UNL students, when you vaccinate them, are they counting for whatever they put down as their city of residence? Like if they put down Lincoln, they're obviously being counted here, but if they put down their home address, you know, their non-school address, then are they being counted in that county as having been vaccinated?
Yes. They become county based on their address, just like the people from Lancaster County that get vaccinated in Douglas County or other places, they are counted in Lancaster County's number. Majority of the students tend to use a Lincoln address because they're here the majority of the year when they're on campus or attending, not on campus, but attending school.
This is Bailey. I have one quick question before we go. Right now with people 16 and up, it's 246,000 people that are eligible for the vaccine. If you open it up to 12 to 15, do you know off the top of your head what adding those 12, 13, 14, and 15-year-olds would increase it to?
We have over 12,000 used 12 to 15, through the age of 15 in Lancaster County.
Thank you.
Mm-hmm. I think we have one more question from Diane.
Right. This is from Dale Johnson at Cameron. He's asking about adding the percentage of people vaccinated and the number of people who've had COVID, adding those together to determine a total percent immune, and how close would we be to 75% if that were done?
We don't, you know, I can't answer that, Dale, because that's not something that we have done. We don't count people who've had COVID because there's no definitive knowledge about how long their immunity lasts. So whether you've had COVID or not, you really need to be vaccinated. And we have had cases where people have had COVID and then had become positive again in 5 months, or 4 months. So people really need to get vaccinated. That's what we're looking at. Okay, thank you.
Thank you, Director Lopez, and thank you so much to our special guests, Dr. Richmouth and Pastor Goodman-Banks and Pastor Larivo. With the help of our entire community, we are making measurable progress. And before we go, we want to remind everyone that it is Election Day in Lincoln. Lincoln voters are choosing members of the City Council, the Airport Authority, and the LPS School Board. And your vote is important. It empowers you to make a true impact on our community. Polls are open until 8 p.m., so there is still plenty of time to go vote. If you received a ballot at home, you can drop it off at the Election Commission office until 8 p.m., but you can no longer drop ballots off at our public libraries on Election Day. If you need to find out where to go vote, you can find that information and more at lincoln.ne.gov/vote. And then finally, we invite you to join us in celebrating National Nurses Week. This observance begins each year on May 6th and ends on May 12th, the birthday of Florence Nightingale. And to honor our nurses, I am issuing a proclamation, and it reads in part, whereas the quality of healthcare and the safety of patients are major priorities in our community, state, nation, and world, and whereas nursing is consistently rated by the public as the most honest and ethical profession, and whereas nurses have faced many challenges during the pandemic and have consistently demonstrated courage, compassion, dedication, and leadership in caring for those impacted by COVID-19 and their families. And whereas in addition for caring for the sick, nurses are now in key roles providing the life-saving COVID-19 vaccines, joining many in our community who have dedicated their time and talents to make our local vaccination clinics so successful. And whereas Lincoln and Lancaster County residents are fortunate to have the leadership and professionalism of a registered nurse, Pat Lopez, leading our community's efforts to beat COVID-19. Now, therefore, I, Lyrian Gaylord Baird, Mayor of the City of Lincoln, Nebraska, do hereby proclaim May 6th through 12th, 2021 as Nurses Week in our community. And I urge all residents to express your gratitude for the service and dedication of nursing professionals. Pat, can you come on up so I can give this to you?
Mayor.
everything you do.
Thank you.
Thank you again for joining us for this update.